Strokes are a leading cause of death and long-term disability worldwide. They occur when the blood supply to part of the brain is interrupted or significantly reduced, depriving brain tissue of oxygen and nutrients. This can cause brain cells to die within minutes, emphasizing the critical nature of timely intervention. Importantly, there are often warning signs that may appear as early as a month before a stroke occurs. Recognizing these symptoms early can lead to preventative measures and potentially life-saving medical attention. Today, we will explore 7 stroke symptoms that may manifest up to a month before a stroke, highlighting the importance of early detection and intervention. Sudden onset of severe headaches. Headaches are a common ailment with various causes, but a sudden and severe headache can be an early warning sign of a stroke, known as a thunderclap headache. This type of headache reaches maximum intensity within seconds and can be accompanied by symptoms such as nausea, vomiting, or changes in consciousness. If an individual experiences an abrupt, severe headache unlike any they have had before, it is crucial to seek medical attention immediately. Causes: intracerebral hemorrhage. A blood vessel in the brain bursts, leading to bleeding and increased pressure. Aneurysm. A weakened area in the wall of a blood vessel that can burst and cause a stroke. Recommended actions: seek immediate medical evaluation to rule out serious conditions such as aneurysms or intracerebral hemorrhage. Monitor for other symptoms that may accompany the headache. Transient ischemic attacks, TIAs. Often referred to as mini-strokes, TIAs are temporary periods of neurological dysfunction caused by a temporary lack of blood flow to the brain. These episodes can last from a few minutes to several hours and often precede a full-blown stroke. TIAs are a critical warning sign and should never be ignored. Symptoms: sudden weakness or numbness in the face, arm, or leg, particularly on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden difficulty walking, dizziness, loss of balance, or coordination. Recommended actions: treat TIAs as medical emergencies. Immediate evaluation and treatment can prevent a major stroke. Work with a healthcare provider to identify and manage risk factors such as high blood pressure, diabetes, and high cholesterol. Unexplained fatigue or drowsiness. Persistent fatigue or drowsiness that cannot be attributed to normal activities or lack of sleep can be an early warning sign of an impending stroke. This symptom might be more subtle and easy to overlook, but is significant when accompanied by other stroke-related signs. Causes: reduced oxygen and nutrient supply to the brain due to narrowing or blockage of blood vessels. Underlying cardiovascular conditions that increase stroke risk. Recommended actions: monitor energy levels and seek medical advice if you experience persistent, unexplained fatigue. Ensure regular health checkups to monitor cardiovascular health. Sudden difficulty walking and loss of balance or coordination. Trouble walking, along with loss of balance or coordination, can be early indicators of a stroke. These symptoms may come and go in the weeks leading up to a stroke, reflecting intermittent disruption of blood flow to the brain. Causes: small clots or narrowing of arteries that intermittently restrict blood flow. Progressive damage to brain regions responsible for motor control. Recommended actions: note any episodes of imbalance or uncoordinated movements, especially if they occur without an obvious cause. Consult a healthcare provider for a thorough evaluation of neurological and cardiovascular health. Changes in vision. Vision problems such as blurred vision, double vision, or partial loss of vision in one or both eyes can be warning signs of a stroke. These changes may occur suddenly or fluctuate over time and should not be ignored. Causes: reduced blood flow to the occipital lobe or optic nerve due to blockages or narrowing of blood vessels. Small emboli that temporarily disrupt vision. Recommended actions: seek immediate medical evaluation if you experience sudden or recurrent changes in vision. An eye examination and imaging studies may be necessary to identify underlying vascular issues. Sudden and unexplained dizziness. Dizziness or vertigo that comes on suddenly and without explanation can be a precursor to a stroke. This symptom may be particularly concerning if it is severe or accompanied by nausea and vomiting. Causes: disruption of blood flow to the cerebellum or brainstem, areas responsible for balance and spatial orientation. Mini strokes affecting the vestibular system. Recommended actions: keep track of any episodes of dizziness and seek medical attention if they are sudden and severe.